potential applications or current applications in a scientific environment or elsewhere that are most interesting to you? I'm personally tracking potential use of psychedelics, which is certainly already in motion outside the U.S. Hopefully will be researched more in the U.S., but as it would apply to, say, opiate addiction. Really problems of epidemic proportions. Are there any particular applications that you're paying attention to?
Yeah, well, first of all, it's really important to understand that this research comes along at a critical moment. Our mental health care system is badly broken. If you compare mental health treatment to any other branch of medicine, mental health care fails abysmally. I mean, it has not extended lifespan, lowered mortality. It hasn't done what work on cancer, work on the heart, work on, virtually other, infectious disease. It's remarkable what a pathetic track record it has. And with all the, use of SSRIs in the culture and shrinks, of which here in Berkeley, every other person's a shrink. The fact is that rates of depression are soaring, rates of suicide are rising dramatically, and addiction too. Is rampant. And so there's a real crisis here. And there hasn't been any real innovation in mental health care since, I would say, 1990 or so, with the introduction of the SSRIs, the antidepressants that work on the serotonin system. So I'm particularly interested, as you are, in the work on addiction. I think that that's very promising, and it's an area where we don't have a lot in the pipeline. Ibogaine is another psychedelic, comes from a root of a tree in Africa, and it has been shown in still very preliminary research to be useful with opiate addiction, partly because it blunts the withdrawal symptoms at the same time it helps you get off the drugs. But it's a very heavy and risky psychedelic, and it lasts for a very long time. There are clinics in Mexico that are administering it to opiate addiction. But there is work planned to look at psilocybin and opiate addiction. Psilocybin and alcohol addiction is underway right now in a large study at NYU that I think bears close watching. And then there's all the work that's about to happen about psilocybin and depression. Treatment-resistant depression is the subject of study in Europe coming up, and that's people whose depression has not responded to two other forms of treatment, so a particularly needy group of people. And then a study in this country of major depression. And that will be getting underway this year. I think if these drugs can really make a dent in those indications, it would be enormous. It would just be, and the depression study is very interesting how that came about. The researchers, had looked at depression in their population of cancer patients. They were dealing with both depression and anxiety, and the results of those studies found that in roughly 80% of the cases, the volunteers had statistically significant reductions in symptoms of depression and anxiety. So a pretty big deal, a very strong treatment effect. Much stronger, by the way, than the treatment effect that got SSRIs approved. But when they went to the FDA seeking permission to do a phase 3 trial in cancer patients, the FDA regulators said to them, we've got a much bigger problem, a much larger population of people struggling with depression, and there's a strong signal here that these drugs may help with depression. So we want you to study that. And part of the reason they did that is they well recognize that there's not a lot of drugs in the pipeline, and the SSRIs are losing their effectiveness, which was never too great to begin with. We're learning, that SSRIs do perform slightly better than placebos, and their effect appears to fade over time. And also, people hate being on them because of the side effects.
So you mentioned something that may surprise people, and that is FDA support in this case. And certainly we don't necessarily have to get into MDMA, but MDMA was granted breakthrough therapy designation
which is remarkable,
expedite the process of phase 3 trials for PTSD. And that seems at odd with something that came up earlier, which was this moral panic after the psychedelic 60s and the Controlled Substances Act and the current legal status of these drugs. So what has changed? I mean, you would think if we look at the mystical experiences and the peace that people feel, or the oneness, the timelessness, the ineffability, one would be inclined to think, hey, if you're trying to treat alcoholism with that, you're just going to give them a state they want to return to over and over again.
Yeah.
Why?
Well, that's a good question. I think it's important to understand that psychedelics are not, the classical psychedelics are not addictive. So it's not like you're giving them another drug that they're going to get hooked on. In the classic drug addiction experiments where you give a primate, when you give a rat or a mouse 2 levers in the cage, and one has food and one has cocaine or heroin, they'll keep pressing the cocaine or heroin till they die, and they'll prefer it over food. If you make one of those levers give them access to LSD, they'll press it once and never again. They don't want to go there. And, if you've used these drugs, your first thought on the conclusion of the experience is not, man, I got to do that again. It takes months to recover. And I don't mean recover, but it takes months to process everything that happened. And it's so disruptive and so extreme an experience that your first thought is not, where can I get my next hit? So there's that. But yeah, I mean, it's a weird idea. Back in the 50s, one of the really interesting stories that you find if you dig into the research deep enough, and the 50s period is fascinating, is that Bill W., the founder of Alcoholics Anonymous, first he got sober after he had been administered a psychedelic, or a drug that some people call a psychedelic, called belladonna in the 30s. And then in the 50s, he got involved with LSD therapy in LA. And he thought that LSD might be able to help alcoholics. And he went to the board, which he was on, of AA, and said, look, LSD, we should really take a look at it. And maybe we want to incorporate it in the program. And his fellow board members are like, "Are you crazy? I mean, that's gonna ruin our brand. That's gonna, confuse people." So there is a kind of fundamental sense that it seems weird to treat a drug with another drug. But these drugs are so substantially different, and they appear to be effective in treating at least some kinds of addictions, that it would be shameful for us not to do the research and explore it. The kinds of risks that are present in it. I mean, there are risks, but addiction is not one of them.
If that's the case, why have these compounds been so